and perhaps nowhere is the U.S. seeing more of an impact from the crisis in Ukraine than at the gas pump. Right now, the national average price for a gallon of regular is about $4.32 a gallon. Here in Maryland, the average sits at around $4.30. And as our Lowell Melzer found, people are going to extremes to save whatever cash they can.
I'm ready to ride a bike right about now.
Not a bad idea considering how high gas prices have gone over the past couple of days. Out at the Sam's Club in Catonsville Wednesday.
Lines long because this is the cheapest gas. Gas too high. Sam's give you a discount when you have a Sam's Members Club card.
Drivers are lining up to buy what's considered cheap gasoline at $3.98 a gallon.
30 minutes already. 30 minutes. A damn, oops, it's a crying shame.
According to AAA Mid-Atlantic, the average price for a gallon of regular gasoline is now $4.23 a gallon, 4 cents higher than Tuesday and almost 80 cents more than last month. Prices do vary quite a bit. Take, for example, this Shell station in Belcamp. Regular gas is $5.19 a gallon. But down the road in Abingdon, at the BJ's, it's $3.99.
I'm sitting here on a quarter tank right now, and I waited too long, but still I'm going to sit out here and get it and wait as long as I need to get it.
Drivers we spoke with were trying to take things in stride, though, many unable to change their daily routines due to work or taking care of their families.
Got to do what you got to do to survive, so it's going to be what it's going to be.
Lowell Melzer, WBAL TV 11 News.
Hey, Lowell, thank you. And we have an interactive guide to those gas prices. See how our state compares to the national average and see the average gas prices county by county. It's all in the WBAL TV app. Pallets and pallets of medical supplies making the journey from Baltimore to Ukraine. The University of Maryland Medical System, along with Johns Hopkins, donated $4 million worth of supplies to the war-torn country. Now, those boxes filled with everything from gloves and gowns to oxygen concentrators and respirators. This comes as some raise fears about how the state of this conflict could reverse progress made in slowing the ongoing COVID-19 pandemic. And joining us now is Dr. Eric Toner from Johns Hopkins. Thank you so much for your time. It sounds like besides the throes of war, there is more that people will have to worry about in Ukraine when it comes to COVID.
Well, yes, certainly there are. Ukraine has been suffering a significant peak of Omicron in the last month. It had started to come down prior to the onset of the war, but there's still a lot of COVID in Ukraine, at least as according to the last data we have, which is now over a week old. Ukraine is no longer reporting data.
When you see video out of there now, I guess I'm curious of what concerns you most and what triggered this thought.
Well, what concerns me is we see these videos of crowded buses, trains, train stations, people huddled together in basements and subways. You know, this is a perfect breeding ground for COVID. And I'm sure there's more COVID transmission going on in Ukraine now than there was before. But the other side of the coin is that the hospitals, many of them have been damaged by the war. And, you know, they are short on supplies, short on medicines, short on personnel. So their ability to care for patients who are severely ill with COVID is diminished.
The countries nearby, because, you know, a lot of the pictures that we also see are those trains being loaded and folks sort of dispersing throughout Eastern Europe and then beyond. Can those other countries, are they in a better shape as far as their containment of COVID as these people come in?
Well, they started off in a better place, certainly. None of these countries had great vaccination rates. But they're certainly better place than in Ukraine itself. But I would expect there to be some increased transmission of COVID in these frontline neighboring countries.
I was reading an article earlier. You're talking a little bit about the oxygen supply as well. Tell folks what your concern is there.
Well, so in many parts of the world, oxygen has been in short supply during the peak of the COVID surges. And in Ukraine, they have three manufacturing plants where they manufacture oxygen. And these have all been closed down, as we understand it. And they are having difficulty getting bottled oxygen into the country. So we hear reports from the hospitals they're short on oxygen, which of course is critically important for COVID patients, but also important for trauma patients and others.
Now, obviously, I mean, you know, in the midst of a war zone, some of these things sort of get put to the back seat because the current threat is the biggest to them. But when you think in public health at this point, is there anything that they can do to sort of stave off some of your concerns in both things, with COVID and oxygen also?
Well, we can certainly try and get more oxygen in, but it's competing with many other necessities, just basic medicines and medical supplies, as well as ammunition and weapons. And so, you know, I hope that they are able to get oxygen in, but it's competing with a lot of other things.
Sure.
And in the hospitals, the problem is, you know, COVID patients are, you know, certainly deserve care, but they're competing with people with gunshot wounds and blast injuries and things like that, which may take a higher priority.
Okay. All right. That's Dr. Eric Toner. Thank you so much for your time this morning. We appreciate it, sir.
You're very welcome. Take care.
You do the same.